Okay, so let's kick things off, and people will come as people will come. So first of all, I would like to say a warm welcome to everyone who has signed up to this webinar on a cloudy-ish Wednesday here in Brussels obviously under the auspices of European Mental Health Week, the initiative that's run by Mental Health Europe. We have one of our dear colleagues here who will be speaking a bit later on that, Camille. And what I would advise you is if you don't know so much about Mental Health Week, Camille will talk a little bit about it, but it's really informative on their website. And in particular, this webinar that we're looking at is following this year's theme, which is Invest in Social Rights. And today's webinar, called Making Mental Health Visible, Data as a Tool for Rights, will be following this in this particular way. Now, to kick things off, we are going to have a video message from one of the MEPs of the recently created Intergroup for Mental Health, MEP Maria Walsh from the EPP party. Unfortunately, she wasn't able to be here in person or online today, as it's a plenary session in the EU, so all MEPs are very, very busy. But she was kind enough to record us a video message that we will put on now.
Hello everybody, and thank you for the opportunity to share a few words for this really important launch. Although I can't be with you in person today, I'm proud to support this initiative as co-chair of the European Parliament's Intergroup on Mental Health, and to stand with you in working toward a fairer, more inclusive mental health system across Europe. This year's EU Mental Health Week reminds us poverty, unemployment, and inequality aren't just economic issues, they are mental health issues too. If we want a stronger, more resilient society, we must treat mental health as a shared responsibility and a social right. The dashboards launched today are a vital step. They offer clear, accessible data on the prevalence of mental health conditions, the impact of stigma, and how much governments are investing and how much more they need to. This kind of evidence helps us see where we are and where urgent action is needed. But they're also showing something else. How many gaps still exist? And that's a really important one. In my work on farming and rural mental health, we see high stress and isolation, but there's no consistent EU-wide data to reflect that. That's why we need more initiatives like this one to make visible what's too often invisible. If we're serious about mental health as a right for all, we need better data for all, especially for those who are often overlooked. And I really want to thank GAMIAN-Europe for this project and everyone else for their work during European Mental Health Week. Let's keep turning data into action and action into lasting change.
Okay, so I think that's a nice way to sort of kick things off. And yeah, I think that was the big theme when we were looking at this this theme for this year for mental health and looking at what we could potentially do with data. And we'll get into it a little bit later on. But it was really making sure and talking about as a call to action to make sure that we do have the adequate data to make sure potentially the size of the issues that we have here. Now, first off, I will give the floor over to the wonderful Peter Kéri, the president of GAMIAN-Europe, who will start off with some opening remarks. So floor over to you, Peter.
Thank you very much, Karl. Good morning, everyone. And thank you for joining us for this really important event. I'm honored very deeply to open today's session on behalf of GAMIAN-Europe and to welcome you to this collective reflection of how data can serve not only science, but rights, human rights, patients' rights, and the rights to dignity in mental health care. Let me begin with a simple but maybe radical idea. Each person is not just a statistics, but a unique form of information. In a world increasingly driven by data, we must remind ourselves we are individuals, not data, but we are not reducible to it. Our memories, our traumas, our joys, our social experiences, they all leave traces. Some of these traces can be turned into numbers, but many of them cannot, or not yet. And still, we must try, and we are trying. We must try to make visible what has long remained invisible, because invisibility is not just a technical gap, it's a form of injustice. That's why today's discussion is so important for many. At GAMIAN-Europe, we've spent years advocating for patients' inclusion in research and policy, but what we now see is that data itself must become more inclusive, not just about what is easy to count, but about what matters. We need tools to reflect the complexity of real people. We need dashboards that don't just aggregate problems, but reveal patterns of neglect, resilience, and opportunity. And we need to ensure that every person has access to their story in the data and a voice in how it is used. That's why I'm proud that GAMIAN-Europe is a part of this project. And that's why I'm proud of the Karl's work and the whole teams have done, not only to build tools, but to make them accessible, meaningful, and empowering. Today is not just about technology, it's about agency. It's about ensuring that person behind the data is seen and heard. And it's about creating a future where mental health is no longer something hidden, whispered, or overlooked. Let's make it visible. Let's make it count. Let's make it work for everyone. Thank you very much.
Thank you. Thank you very much, Peter. Now, there was one big thing that I missed that my comms team are screaming at me for missing. So I will just quickly, for those who maybe do not know about GAMIAN-Europe, just do a quick introduction of who we are, which is only rightly so. Peter touched on it. But basically, for those who may not be aware, GAMIAN-Europe is a pan-European coalition of mental health patient organizations, or organizations with people with lived experience. And we work in three sort of main streams, or three main areas. That's advocacy, education and awareness, capacity building, and research. Now, within the advocacy area, I'm very happy to say that along with Mental Health Europe here, we were able to help support the formation of the first Intergroup for mental health, which is basically an informal group of MEPs who are interested in mental health across political parties. And very soon we will be, or they will be, promoting the work plan for 2025 and looking at the different themes for at least 2025 on mental health. So I would really encourage you to look out for that. Education and awareness, well, this is one of those events for different weeks or days throughout the year that are important to mental health patients or important to our members. We try and come up with projects that they are interested in. So for example, today, the eventual launch of the dashboards looking at different statistics was an idea that came from them. And finally, and as Peter sort of touched on, we're quite heavily involved in research. And what this means is basically for us making sure that within the EU funded projects, within Wellcome Trust funded projects, within these big sort of funded projects, that the patient's voice or the lived experience voice is there throughout. And what's that meaning is basically making sure that it's from the creation stage of the proposal all the way through to the dissemination phase to make sure that these projects that are for people with lived experience are really served by them and really co-created with them. So that's probably more or less it in terms of any other activities, or if you are interested in any of our previous projects or future projects, current projects, feel free to go to our website, which I will write in the chat in a minute. And without further ado, I have the absolute privilege of passing over to my colleague from Mental Health Europe, Camille. I will just give a quick introduction for her. So after a master's in human rights and democratization at the Global Campus of Human Rights, Camille moved to Brussels to work in EU affairs. Since then, she has been working with various NGOs defending the rights of groups in vulnerable situations within EU policies. In her last job as Senior Policy and Advocacy Officer at CoFace Families Europe, Camille focused on disability rights and gender equality. Her focus on social policies led to her witness firsthand the detrimental effects of discrimination, inequality, and exclusion on mental health. She joined Mental Health Europe in January 2024 to advocate for human rights and social rights of persons with mental health issues. And I can just say on a personal note, she's been extremely instrumental as well with all the work that she's been putting forward, helping out with the Intergroup. So Camille, over to you.
Thank you, Karl. Hi everyone, and happy European Mental Health Week. So as Karl said, my name is Camille Roux, and I work now as Senior Policy and Advocacy Officer for Mental Health Europe. So for those of you who are not familiar with our work, Mental Health Europe is the largest independent network organization working on mental health at the EU level. And what I'm stressing here is independent because we do not accept any funding from the pharmaceutical or the medical industry in whatever shape or form. And this is something that is quite important for us. What we do, among other things, is every year we run this European Mental Health Week. It's the 6th year now, and as Karl already said, the theme this year is social rights. So I don't want to talk your ear off about European Mental Health Week, but my comms colleague have worked on a very, very nice video that I would like to share. We always know how it goes in this event. We practiced before, but please be patient with me. I'm going to try to share now the video. It's just 2 minutes. So normally it should be okay. Karl, give me the thumbs up if that's working on your side. Actually, I can't see you, so unmute and
So
speak.
we have video.
Yeah?
Let's see for audio.
Okay.
Yes, we have.
Perfect.
Thriving in everyday life isn't easy. The world we live in is full of uncertainty. Financial pressures, social isolation, and never-ending distractions put pressure on all of us. When social rights are not in place, or don't consider these life pressures, it adds to the burdens we carry. Fear of not having a job, no matter how hard we look. The threat of losing our home. Income insecurity and the lack of access to quality health or childcare. Increased inequalities and social exclusion. The added weight of all these fears and pressures can be enough to stop us in our tracks, and in some cases, break us. But imagine if societies and governments used forward-thinking social policies to create a different path. And instead of adding to our mental health challenges, helped to lift them away. By creating more pathways to employment, fairer housing policies that allow access for all, assurances that people have access to proper income and are cared for when in need. Open, supportive, and inclusive communities where even those who are facing problems can contribute. What if these policies empowered us? Restoring dignity, building communities that thrive. We could transform the hard road ahead into a pathway for hope and mental well-being that not only lightens the load, but lifts us all. To learn more about how your organization can help lighten the load, visit www.mentalhealtheurope.org.
I like it. So that's our video for this year. And I think I've been a bit lying to you. I'm still going to talk your ear off. I'm a policy officer. But so I think when we are talking about the theme of this year, I'm here to set a bit the theme. As Karl said, this event is under the umbrella of European Mental Health Week. So my role here is to explain you a bit what is European Mental Health Week about and why did we choose this theme for this year. So I want to walk you through a bit on our thinking of why we thought that it was so important to talk about the link between social rights and mental health this year, and why did we choose to address it with European Mental Health Week campaign this year? Well, the answer is twofold. First of all, and I think it was quite clear already with the previous intervention, is because there is a real urgency to respond to the mental health need. In Europe, we see the situation worsening in every country, but at the same time, at the EU level, there is a momentum to do so and to channel this answer through the social rights agenda. And this is really an opportunity that cannot be missed. So at Mental Health Europe, we are seeing that even though there is this increased political attention to mental health that came a bit in the aftermath of the COVID-19 crisis, the overall situation is still worsening. And what it shows us is the inability of our system to meet the scale and the complexity of the need. And that's why also having this event today on data is very, very important. I think Peter also pointed in his introductory remark is at the moment, we see the article, we see some data going around, but we do not have the tools that are there to really have this comparable analysis, to really see like which group are doing a bit worse. So we have bits and pieces of information, but we do not have the full picture. And that's why initiatives such as this one of the dashboard are very, very important, because we know about the scale and the complexity of the need, but we know through examples, we know through testimony, we know through some study that will have been done in a region or in a country, but at the European scale is really, really hard to really measure what's happening. So that's one of the core challenges that we have. One other that pushes us towards the theme of social right this year is we see a continued dominance and even a resurgence of what we call the biomedical model in the published discourse and in policy discourse. And this model is a way of seeing mental health that is really narrow, that reduces mental health to an illness to be cured, that is really disempowering for person with mental health problem. They are treated, they're seen as this, it's leads to stigmatization, to them being in a narrative that is not really empowering, that exclude them from society, exclude them from finding the solution. And it's also totally ignoring the other factors that shape our mental well-being, which are the social, economic, and environmental factor. Like every day we are faced with events, with things that affect our mental well-being. And this is not just something that's happening in our head. So we see this common trend all over Europe. So that means that we need a common European answer. And Mental Health Europe, we've been looking for 40 years now for this European answer. And for us, one of the core of this is advocating toward the psychosocial model of mental health, which is a model that will recognize and address the full range of these mental health determinants through what is called a mental health in all policy approach. So looking at the impact of every policy on mental health, but not only looking at the impact, but making sure that this policy can have a beneficial effect on mental health and well-being. The psychosocial model also addresses what we call the full spectrum of mental health. So it does not only focus on mental health care, but also work a lot on prevention and promotion. So that's mean like, let's not try to fix the problem. Let's try to make sure that we have protective factor in place in the society. So we don't need mental health care, or we reduce the need, because not needed is not something that is happening, but we just like make sure that we work together and we have all the elements together. And that's really the vision that we want to see embraced at the EU level. And for this, we need this comparable data. And I liked very much what you say, Peter, in the introduction about the invisibilization. And when we are talking about social rights, we are talking also about this discrimination. And discrimination can also be based on the fact of having a mental health problem and being excluded from the society from this point of view. So really with this year campaign and the policy brief that we have published to support our argument, and that is available on our website, you can really see we are trying to demonstrate how this psychosocial approach can be used today using existing tool at the EU arsenal, such as the European semester, that are very important for that, the European Pillar of Social Rights, and of course the EU budget, because well, both data and funding are a bit the common. In French, we say le nerf de la guerre. I can't remember how to translate this expression in English, and I'm sorry, I've tried right now. But so, Karl, if you have it, please let me know after. But I want to focus a bit more about the European Pillar of Social Rights. For those of you who don't know, the pillar is something that was adopted by the EU in 2017 and is made of 20 principles that are all very, very relevant to address the socioeconomic determinant of mental health. Because mental health means having a roof over your head, and not just any roof, but an adequate house for your family that is accessible, that is affordable, having work-life balance, having job security, and living in an inclusive, fair, and equal society. And all of this is in the pillar. And at the moment, the European Commission is preparing the next action plan for this framework. So that means like, how are they going to implement this? So our call also with this European Mental Health Week is that now is the time to really make a conscious and consistent effort to make sure that we use this framework to address mental health determinants, that we don't just hope that mental health and well-being is going to be an outcome of our policy, but we make it a concrete objective. And for us, having this mental health in all policy, this mainstreaming is part of the answer. But the other part, and this is very important, is the problem that you have in the mainstreaming, is that sometimes these initiatives are very scattered and they are very siloed. So there's no communication between the different persons that are supposed to implement. There's no monitoring. So that's why we are calling for a European strategy on mental health that would have clear objective, timeline, dedicated budget, and robust monitoring mechanism. That means that we will bring all these fragmented parts into one initiative that will ensure implementation, funding, and monitoring. And for this, data is very important because, of course, there is a question, like there is so much that the European Union can do, but for the rest, it's also something that we will need some action at the member state level. And to be able to monitor this action at member state level, we need data. And we need to be able to compare it, because the idea is not to have one country doing better than another. There is this idea of upward convergence. So, okay, let's see, maybe one country is going to do better in one area, but in that case, let's organize some peer learning. Let's make sure that we are moving all together upwards toward better mental health for all in the European Union. So that's what I wanted to talk to you about the theme of this week. Of course, we are just Wednesday, so there's still like a few days of the week. If you want to engage, please, I've put the link in the website. You will find the policy brief. You will find also resource for social media engagement, a bit more explanation about what we are doing around the week. So there's still time to engage. The theme is very, very important. And of course, I said that the European Union will be working on the next phase of the pillar action plan. This is also a way that you can engage. These consultations are public. So that means like you as a citizen, as an organization, as a professional, you can tell the European Union what you want them to do through this consultation. So at the moment, you have some consultations that are open that are very, very important on the LGBTQIA strategy, for example, on the anti-racism action plan, and on the gender equality, which are all very, very important for mental health. So if you have some time, just have a look and just make sure that you answer and that you stress the need for this policy to be strengthened in order to improve the well-being of the full population. Thank you very much. And I'm sorry about the drilling. I don't know if you heard, but they did not stop.
Thank you very much, Camille. Really comprehensive as always, and at least from our side, I didn't hear any drilling, so double thumbs up for that. And apologies to everyone from the chat. I just realized up until now that I think we had somehow been a little bit elitist in the chat and made it only so panel members and hosts could chat, but I have copied in both the link for GAMIAN-Europe's website and as well Mental Health Europe's website, specifically the part that Camille shared on the Mental Health Week. So apologies for that. On another note, if you do have any questions for Camille or for any of the panelists, as you may see later on, we're going to be having a panel discussion. So what I'd say is either put them in the chat, or if you want to, during the panel discussion, if something pops up spontaneously by a question that we do, feel free to either put it in the chat, or we can, if needs be, we can let you take the floor. Right, so onwards and upwards. Next we are going to go over to Vladimir Litoshenko. I hope my pronunciation isn't too awful. And I will just look at his, I'll just read out his bio. So Vladimir Litoshenko, Senior Vice President at First Line Software, has been in the professional software engineering business since 2002. For over 20 years in the industry, he was a software engineer, project manager, and manager of software engineering department, focusing on business development and HR. Nowadays, on the EU market, Vladimir is focusing on digital solutions for healthcare, including projects related to the European health data space. So hopefully that's okay. Vladimir, feel free to share your screen, and very curious.
Thank you very much, Karl. Okay, so, but I need someone to stop sharing. Okay, great. Yeah, thank you for a great intro, and it's really for me a pleasure and an honor to be a participant in this webinar. I hope you can see my screen now. Well, yeah, okay, great. Yeah, as it was already presented, I'm not from the healthcare or policy side, I'm from digital side, focusing on the healthcare. Yeah, so I will try to make my speech more focusing on data, because as Camille already shared today, data is crucial. Yeah, but from other side, data could be dangerous. Yeah, so we need to be very careful when we work with the data. At the same time, if we don't work with data, if we hide the data, it's nothing we can react at, nothing. There is no way how we can make our life better nowadays. Yeah, so I will try to focus from this side on what is going on in the healthcare space, in the mental space in the European area. And yeah, let me start. First of all, yeah, the fact is that for many years, mental health was really underfunded, underestimated, and was hidden from the entire data space in the European Union. Yeah, a lot of data never been visible for policymakers, for healthcare professionals, for us as citizens. Yeah, were not used. And in that case, if you don't have data, you cannot react. If you don't have data, you cannot measure anything, and you don't know what's happening, right? So for many years, in many different industries, people were thinking how to get value out of the data. Yeah, but unfortunately, for many years at the same time, especially in the mental area, these data were hidden. And the fact is that due to some surveys, yeah, European Union realized that almost half of people in the European Union experienced some mental distress. And it's pushed, I believe, it's pushed EU and EU government to start investing in the area of data visibility. And as you can see, over the €1 billion are going to be invested in that. And the good thing is that more than 700 million investments are in research and innovation, which may bring data and which may bring the quality of life of EU citizens to the better level. Data provides visibility. Yeah, data drives every part of this kind of market to make some improvements. Yeah, to make analysis on top of this data, to focus on the better care. Yeah, if we need to focus on the better treatment and to focus on individual treatment, because especially in the mental health, it's very crucial that there is no single solution which fits to everyone, because we all individuals, we are quite specific ones, and we need to have special treatment. Yeah, but from other sides, if you're talking about data and the rights, it's very important that our data are used properly, and we as producers of this data, and in some case owners of this data, can manage how this data are used, which data are used, who has an access to my data, and how can I control that. Mainly, just to sum up, yeah, from one side, data gives the transparency, data gives ability for better care, and the good thing that, and I will show you later on, with current regulation, which is already available, and with the different programs which are happening now, we as citizens are going to be empowered, having the right and abilities to control, and really to control our data in the way we should be able to do it. Yeah, because especially, let's imagine, I mean, our health data, our mental data are stored, I don't know, somewhere on papers, and they can be lost. Yeah, they cannot be properly accessed, and it's a huge problem. Yeah, if data are in a digital format and the access to this data is controlled properly based on EU regulation, this is something which really can empower us as the citizens and can make our life much better than it is. And the first program I want to mention, and I suppose some of you already know about that, but it's a really big step forward in European Union space, is European health data space. Yeah, the regulation was finalized beginning of this year, and nowadays all the countries are moving forward to implement this data interoperability layer all over the countries in the European Union, which can make available and accessible data in between of the countries. And first focus is on the primary care, and it will help clinicians and us to get better treatment. Yeah. Another part, and it's, from my perspective, in terms of especially mental health, it's even more important. It's secondary use of this data, which is focusing on research and innovation. And imagine you are, I mean, I'm living in Slovakia, yeah, and I need to go to, for example, Germany, yeah, and if I would need my data, my health data to be visible in Germany, I can make it happen without any issues, yeah, and I can use this data there where I need it. But from other side, yeah, if you're talking about mental health data, mental data especially, it's this very extremely personal data, yeah, and we definitely don't want anybody to see this data and to get access to this data without my personal approval, yeah. So, and the good thing that EHDS regulation gives these abilities and specifically defines that we as a human beings, we as a EU citizens, we are in some aspect we are owners of our data. Yeah, we cannot sell it. Yeah, I suppose nobody wants to sell data, but we can really manage how this data will be accessible, by whom this data will be accessible, in which form this data will be accessible, and we can prevent access to this data if you don't want it. Yeah, for example, if I don't want my data to be used in some specific research, I can prevent doing that. And it's really great that it's very strictly defined in EHDS regulation, and now each and every country have to implement it in the way as it's defined. Yeah, hopefully till the end of 2028, as it's planned at the moment, this infrastructure will be implemented, and we will see how data how this interoperability layer, how data being transferred in between the country will improve the quality of life in the European Union. European health data space is based on two very important regulations, and one of them is GDPR. Yeah, and GDPR treat mental health data, specifically mental data, as a highly sensitive data. That means that we as a people and everybody who is somehow working with our data has to be very careful in the way how this data are stored, where this data are stored, who can access this data, and mainly we as people, we can easily check for specific company or specific research organization how our data is used, who has an access to this data, who had an access to this data, and if needed, to prevent this access. Yeah, and we have the right to work and to give an access to our data in the way we, let's say, want to do it. The second part, which is very important, especially nowadays in the digital world, because everything what is happening around the data nowadays is really connected to artificial intelligence. And from one side, artificial intelligence and generative AI, which probably all of you already tried to use with all these ChatGPT things. Yeah, it's a very nice feature. Yeah, but from another side, if you, for example, put your mental data into, I don't know, any kind of public large language models, which now accessible, yeah, you cannot be sure how this data will be used. Yeah, because I mean, large language model will learn based on your data, and it means that your data will be easily, in some ways, could be in some form accessible from the areas which you don't want to be them accessible. So in that specific case, when we are focusing on AI tools and in mental health as well, I will show you later on these digital avatar tools, which really help people with different diseases, like, for example, schizophrenia, yeah, to get a better care. They need to be designed very carefully, so data are not, there is no data leak, yeah, and data are stored and used only in the way they should be used. And for that, mainly EU AI Act helping us to focus on that. One of the examples I want to share with you, and it's already been told, that having access to the data and work with data is not really enough, because especially in the mental health area, a lot of data are stored in an unstructured form. Yeah, it might be just notes from clinician or some materials from the patient, just in the natural language, yeah, without any structure. And these data, in fact, are useless for data analysis, for example. System cannot understand this data until it's structured properly, until it's recognized properly. And nowadays, with the help of AI, yeah, we can easily transform this data from different languages to structures which can be analyzed, can be measured, and if you can measure something, you can manage it. Yeah, and it's really very crucial stuff nowadays in the area of digital health and data management in the mental health area. Another one case, which I already mentioned a bit, is kind of digital avatars, which is a really great example how our mental and how our life can be improved, because it helps people in different aspects. Yeah, it helps in elderly care, it helps people with schizophrenia sometimes. When you have a digital avatar which is accessible 24/7, which knows everything what you allows it to know about your mental health and can help you to react properly on what's happening with you, and at the same time can alert clinicians if there needs to be some additional support from the professional side. To sum up what I'm talking today about, I want to focus on the, let's say, it's called data altruism. It's one of the aspects defined in EU Data Governance Act. Yeah, and it's mainly kind of the way of, let's call it data donation. Like some of us donate blood to save some lives. Yeah, here is defined the way how we can donate our data, but at the same time, we should be very careful, right, when we are sharing our data. So donating this data, we're becoming a partner, not just a just a source of the data, but we're becoming a partner for different type of research and activities, which we are participating by contributing our data, and we are able to identify if and for which type of, let's say, research this data can be used, and which of these data can be used, just to avoid the situation that our mental data, which are extremely sensitive, yeah, are used not in the proper way as it should be. So to sum up, from one side, we can see nowadays, especially in digital health world, that data are becoming more visible, and it's good because using this data, we can really react from the professional side, from the research side, and support citizens and us with better care. Yeah, it empowers us as a citizens, as a people, to control and to own this data and to control how this data are going to be used and who can have an access to this data. And again, yeah, it's all about our collective responsibility, and for tech innovators like we are, for healthcare providers, for policymakers, and for citizens. And properly working with this data, I believe will really bring European Union to better level of life and to better level of care. Thank you very much. I hope it was interesting, and sorry for my dog barking.
No worries, no worries, and really fascinating, honestly, Vladimir. And I really hope that hopefully within the audience there is someone from any of the policy teams within the institutions listening and really understanding how important these having this sort of data is, and making sure exactly that, as you say, that it's harmonized in the right way, that it is with dignity and with all the correct things taking place. So really interesting. So I will check with the panelists for afterwards, but we've already had a request in the chat, if it's okay with you guys after, for those of you who have slides, if you wouldn't mind sending the slides, and we can send it to those registered. So that's fine. And great. So up next, we are running a little behind, but that's no worries. We are going to be moving over to Ahmed El-Salawy, because I wrote his name twice wrong on LinkedIn, so I think we got it there, from IGLYO. And I'll just give him, I'll just say his bio, and then I'll let him introduce maybe the work that he does with IGLYO and a little bit about IGLYO. But Ahmed is the Policy and Research Officer at IGLYO, Europe's largest LGBTQI youth network, where he focuses on issues affecting LGBTQI youth in education, health, discrimination, and other key areas. He has worked with Human Rights Watch LGBT team, contributing to investigations and documentation of human rights violations in the MENA area, or MENA region, excuse me. Ahmed has also been part of ILGA World's UN advocacy team, and prior to that, he was actively involved in refugee protection efforts with UNHCR and Save the Children. His work has particularly revolved around supporting survivors of sexual and gender-based violence, as well as unaccompanied and separated children. So Ahmed, over to you, and thank you.
Yeah, thank you so much, Karl. Can everyone see my presentation now, or perfect? Okay, amazing. So yeah, thank you so much for inviting us, and like keeping up with the theme that Camille said about having it like this year. I think one of the best representatives of having like the social factors impacting your mental health would be the LGBT youth, because most of the mental health that LGBT youth are impacted with are caused by preventable, let's say, reasons, as is discrimination, bullying at school, not finding support at home. All of those like elements can be prevented and can completely impact like the mental health of LGBT youth. And we can see from the data that we're gonna explain, we talk about today, that unfortunately they have like the numbers of LGBT youth being impacted with mental health like adversities are like double and triple the numbers of their peers who are like heterosexual or cisgendered. So it has a really, really huge impact on LGBT youth, and mental health is one of the biggest issues that are impacting them. And before I start, I just want to give a little bit brief on what is IGLYO. IGLYO, we are the LGBT youth and student network. We are the biggest youth and student network in the world. We have around 120 member organizations across the region of the Council of Europe. We have been founded since 1984, and we're based in Brussels. And there are three main things that we work on. One thing is like advocacy. Another thing is the capacity building, where we help the youth organizations be able to work within their national and regional spheres, as well as like we engage youth on several issues like through social media and other platforms. And what we noticed, and I think this is like something like many of you like maybe have seen in their work as well, that there is a huge data gap when it comes to LGBT youth. So basically, like I'll tell you a little story. Like we decided to make like a youth conference in Zagreb in Croatia in 2022, and it was a youth conference, so we brought like so many like youth activists, around like 25 of them, and we wanted to discuss like health. And one of the things that youth like said as a top priority for them is like mental health. It's one of the things that really impact them and affect their everyday life and how they go with their everyday interactions. So we decided to do something related to that, to be able to mitigate all the risks related to mental health, how we can like better the policies on the European and national level when it comes to mental health, in order to help like LGBT youth. But then unfortunately, when we wanted to scan and see what are the data that's out there, we found that the data are very, very limited. And the thing is, because the complications of being like an LGBT youth is that most surveys and most data collected doesn't see it as an intersectional, as if you are on one person. So for example, like if you have like data on LGBT people, they don't do the age group or the age group of like being a young person. It's just like a general, like statistics. And when we go to statistics about youth and children, you're going to find like LGBT people are completely excluded from that as well. So it lacked like this intersectional perspective when it comes to the data. And we found like, yeah, all the mentions, even in policy, when we have like national strategies or national action plans for youth or children, it lacks information about like LGBT youth and children, and the same as like the LGBT action plans, they don't mention youth as well. So one of the things we decided to do is like we launched like a research survey. It was like the next year in 2023, and we decided to try to collect that data ourselves and to be able to collect it from a quantitative point of view and as well as qualitative point of view, because so many times like also the numbers don't show really the experiences and the impact of you know, like the reasons of what like what's causing like adversities for mental health for LGBT youth. So we wanted like those stories to be part of it, as part of the narrative and as part of the storytelling of this research, and it's just like only numbers. So we conducted around like survey in 4 languages to try to be as inclusive as we can. 20 interviews were like more like in-depth interviews, and one of the focus areas we wanted to look around was like suicide risk, violence, schools, access to care. One of the most important things, and I think Camille also like mentioned, was like the impact of like rural and the isolation of like LGBT youth in the rural areas, as well as racialized youth. And that's like something also that's very messed, like putting the element of race, having a migrant background or a refugee background, and how that like even impact your mental health in a strong dimension. So this also like elements that we wanted to put in our like surveys and in our research to try to like fill that gap that's currently like at the moment like available in the research. One of the things that we wanted to do with that data also like to use it in our policy impact. So one of the main things, our policy elements are like we have the Council of Europe. We try to like provide like consultations and include LGBT youth when it comes to like, for example, like the Committee of Ministers reviews. So every few years, like there's a Committee of Ministers review on one element of LGBT rights. One that was recently was also on health. So we try to include LGBT based on that data and the information that we get. We try to like inform them on and tell them how is the situation is and how LGBT youth feel when it comes to the mental health like challenges they're going through. And we try to help them like make policies that would inform or mitigate such risks. The same with the European Commission. And during the health policy platform as well, we try to engage on that forum, and it's great to know about like the achievement that you did like in GAMIAN and Mental Health Europe about having now the Intergroup, and I think it's going to be such a great opportunity now to also engage with the Commission and the Parliament and everyone, and try to include all the marginalized community within their policies. And another element we try to do is working with schools and on national level as well and local level to try to help them like find strategies on how to help their own students and when it comes to mental health. One of the main challenges we're facing now, it's like, let's say, socio-political trends we're seeing around like in Europe and the world, is like we're having like now there's huge rise in like concept of populism and anti-rights discourse, which try to, for example, like completely erase any LGBT identities from any sort of policies, from schools, especially LGBT youth. That's like the hardest attack. And try to separate the concept of like you can be an LGBT youth and you can still be young, and try to make this as vis-a-vis with other groups like LGBT youth with youth groups and children rights, or like vis-a-vis with like women's rights, and try to use like this like divide and conquer and having scapegoats to gain like political gains. And unfortunately we're seeing this like gaining like tractions and gaining trends, and we'll see how this will impact and I'm sure like this will impact like a lots of like the mental health of young people when they see their identities being attacked, they're being villainized. It will force them to get into the closet again, to not be able to find like support groups. So unfortunately it's something that is happening, and we'll see how extent such policies will be on coordinating on civil society and us working on the mental health like areas. We're also finding a little bit some institutional resistance from some EU members and some EU institutions as well. And this, of course, is impacted by the national elections of each country. So if we have like a right wing like parties winning, it's completely impact like, you know, like the policies that are inclusive of LGBT youth. We find, as I said, like also the policy approaches are fragmented. We don't see humans as like an inclusive, intersectional entity, and that we all encompass like so many identities and characteristics in ourselves, and we try to divide this in a few different policies, and it's so hard to like connect, like those policies with one another. So like policies on race, on gender, on health, they're completely like don't put into consideration all those intersection elements, as well as we notice that there's a need of like this collaborations between us working on cross sectorial like areas. Like now what's happening now, we work more on LGBT rights like focus areas, but now you work on mental health like other mental health like policies. And I feel like this like sort of like collaborations between all of us would help us like to have like better policies for the marginalized communities that we're supporting and helping. So one of the, I would just like put like from our research, like one of the recommendations that we got, there are three main elements of recommendations that we found LGBT youth, they told us that they need. The first thing is legislation. Like one of the biggest issues that they said that they suffer from and impact really their mental health is the conversion practices. It's still happening in Europe. It's still invisible. It happens in so many communities, and not all countries are like working on that. Only recently there was like a European initiative, citizens initiative that had like I think over 1 million signatures that are calling the European Union to like ban conversion practices. And I think it's one of the biggest issues that really impact LGBT youth, because they usually also suffer from this from a very young age, and the trauma that comes out of it like lasts for a lifetime. Another element is like legal gender recognition. We noticed that like when you have like affirming policies, it really impacts like the mental health of so many of the trans and non-binary and gender diverse like young people, as well as we're demanding that we have like an EU mental health strategy that would be inclusive of LGBT youth, and it doesn't sideline LGBT youth or like overlook them. Another thing is like healthcare. Healthcare is one of the most important elements as well. Many of the youth, LGBT youth, they said that they couldn't afford like mental health services. They didn't know how to do it. They also like find troubles having mental health services that's affirming and supportive of them. And that includes like the training of the mental health providers. So we assume mental health providers are all going to be up to date with all elements, and they'll be like open-minded and inclusive of LGBT identities, but unfortunately it's not the case in so many areas. So this is one of the main demands that like many LGBT youth face, and makes them also like fearful of going and seeking help when they know like the other person could be judgmental or like won't understand where they come from. So they don't want to add an extra burden when they go and seek support. So many of them like altogether refuse to seek such support. And as I said, like one of the most important elements also like thinking about all the LGBT youth who are in rural areas who cannot access any of that. They're not in urban centers where they can find like community centers and find LGBT peers as well, LGBT youth peers who can support them and who can help them. So there's such a big issue, as well as the youth who are also another social factor who are homeless. And there's a high number of LGBT youth, of course, upon their coming out, or if they're being like outed for whatever reason, they get kicked out from their homes, they get disowned by their families. So like a huge number of the homeless youth come from LGBT populations, and it's something that also we need to consider, and the impact of that on their mental health. One last element was education. Of course, like LGBT youth spend most of their time in schools. It's one of the make or break moments in any person's life. I feel like many of us, like all them, like we remember like many of our moments is at school, either like bullying moments or like good moments. So it has such a great impact on LGBT youth. And one of the things that they asked for or like was prioritized by them is like having like the option of gender neutral facilities at school, that they want like better measures to combat anti-bullying. They wanted also accessibility of like mental health on school like premises, and they wanted it to be anonymized, private, and safe. And well as they said that teachers, they would wish that the teachers and educators are more aware of LGBTQ issues, and they would be more sensitized to the needs of LGBT youth. And yeah, Thank you. This is like the research. I'm gonna like send like a link. Like we still like we have like the draft, the first draft of our research like published, but the final draft will be published soon. So I'm gonna put a link in the chat if you are curious to look more deeply into the data and see what the LGBT youth said regarding all of this. Thank you so much, and yeah, thank you for having me.
And thank you very much, Ahmed. Obviously, there's some tough topics in there, and just to reiterate, as we were saying before in the practice webinar, it's really good to see within the intergroup so many of the MEPs definitely, at least with the political will, there is a lot of political will there to make sure that the different communities of the LGBTQIA plus communities are looked after. As Mark Engel was saying, the MEP from Luxembourg yesterday, he was also noticing, he was saying for the first time in his life, coming from quite a privileged family, that he as a gay man was really starting to feel that there were these pressures really coming up, and he was starting to not feel safe. So I can only imagine people who have a lot of this intersectionality of different vulnerable communities. Right, so next we are going to go from less of a European level, and actually we're going to zoom in to one of the countries, and we're going to have a conversation, or she is going to present the case study of Portugal. It's Joana Moris Encastro, and she's the president of Encontra-se, who's one of GAMIAN-Europe's members, and I'll just get her bio up. So Joana Moris Encastro, I'm so sorry, the pronunciation is so bad, is graduated in law from the Portuguese Catholic University and is a specialist in human rights. She has been dedicated to social and community intervention missions in Portugal and abroad. She is the president of Encontra-se and a member of Voces de Esperança, a project that seeks to improve the way that we all think and act about the experience of mental illness via storytelling. She also works as a teacher and inclusion specialist in the transversal area of social economy at the Catholic University of Porto. She loves writing and seeks to use these narratives to create empathy, compassion, and combat stigma and prejudice. So, Joana, over to you, and thank you so much for being here.
So thank you so much. Hello, everyone. Are you listening? Well, yes, okay. So I'm going to share also here my presentation. But first of all, I just want to really thank you for the opportunity of sharing my story, our story, and allowing me to show a little bit of Portugal and our lives here in Portugal. And also, I want to, sorry, I'm just, okay. So first of all, let me introduce to you that Portugal has one of the highest rates of mental illness in Europe. Access to mental health care is still limited. Many people face long waiting times, lack of mental health professionals, and geographic inequalities in care. Stigma and discrimination remain major barriers, not just for those living mental illness, but also for their families. So in contrast, it's a non-profit, non-governmental organization that works to change mindsets, support recovery, and empower communities. We strongly believe that mental health is a human right and that everyone, regardless the diagnosis, should be treated with dignity, listened to, and given a voice. So let me try to be a voice now. I was raised alone with my mother since I was 4 or 5 years old. If you don't mind, I want to share you our difficult days, the acceptance, and also the treatment, and nowadays and the future. I'm speaking not only about our story, but please interpret that it's about the story of many people like us. So about difficult days, I often find it hard to say which days are hardest, the ones that of the couch cushions were soaked with tears. I didn't know that tears could be infinite. Or the ones marked by fear, about being watched, about being followed, about being spied on. Or even those euphorical, reckless days of truly adventures that we lived. But through it all, even in the darkest moments, I always saw something powerful in my mother's eyes. That is called love. An immense and absolute love. A fierce fight to be my mother and to give me a balanced and beautiful life. Maybe the hardest moment was thinking that I lost her, not recognizing her eyes anymore. Few years ago, in one of these long and psychiatrical hospitalizations, I feared that I might never get her back. The place felt like hell to me, undignified, cold, unhuman. I was completely angry with the system. I was angry with the illness, the institution. I was angry with everyone. For months, she didn't speak. I visit her every day, and we just sat silently side by side. Then, one day, she took my hand and she said, "Joanna, in every moment in life, there is beauty. And you must believe in that. Never, please never stop believing that." Well, this sentence changed everything around me. I was a true daughter that obeyed to her mother, and suddenly the garden's tree appeared to me. I wasn't afraid of the lady in the hallway anymore. I really, in the last days, I even hugged her. And beauty really saved me in that time. I think was not made perhaps beauty, but my mother. You know that we can't remove the difficult days that come with a mental illness, but we can learn to live with them. And yes, we can be beauty in there too. But self-stigma and acceptance sometimes are very hard. My mother always knew she was not well, but there was never a clear diagnosis, at least not openly discussed with her. And my childhood was filled with unexplained hospital stays and long silence stretched from my mother. When I was about 5 years old, I stopped speaking for 2 years. It's called, I think, mutism, and it's a kind of a way of relating with trauma. For me, it was not that. For me, it was very peaceful. The silence was peace, because I thought that adults would make so much noise, and noise hurts me, still does. So I thought I was like Harry Potter's, you know, that blanket, that Harry Potter's, that silence would protect me. And this is also a side effect of stigma and isolation. My mother was very intelligent and began to write me letters, and I started to respond it. That was how we communicated during years of our lives, and we still do that. When I was pregnant of my first child, the psychiatrist finally wanted to have a talk to me and said, you know, some of the people and conspiracies your mother believes in, they don't exist. That's the illness. Truth. You didn't live that. That was not the truth. So truth. Truth, I felt like the ground fell beneath me. Was everything a lie in our lives? So after a long internal journey about truth, I decided to stop calling it a lie. It was our truth. What was our reality? Maybe invisible to others, but real to us. And I won't live ashamed of it. And in that time, we finally had our conversation, mother and I. We broke the taboo, the diagnosis. schizophrenia. And we made a decision. Our family, it's not a disease. My mother is not a disease. The illness is part of our life, yes. So let's put it on the table with honesty and even joy. Because we are not victims, we are completely the protagonists of our stories. And we try every day not just to accept illness, but even to love it. To love schizophrenia, it's strange, I know, but it's a way that we find it, it's a way to live in. Because love always helps us move us forward. So maybe that helps us too. So over the past decades in Portugal, I've seen psychiatry changing a lot. For decades, my mother had a strong but solitary connection with her psychiatrist, and there was a very little space for me, for the family to understand and to participate. And especially in moments of crisis, when medication was stopped, I felt helpless. Only recently, after a particularly difficult hospitalization time, we finally found an integrated approach. It was in contrast to that we had finally access to good treatment, but I know that this doesn't happen to everyone. I know that our case is rare because there is serious lack of dignified, accessible mental health service in Portugal. Nearly 22% of the Portuguese population experience mental illness. And yet, support structures are insufficient. There are not enough professionals. Families are completely left alone, and stigma still silences too many voices. And answers like, in contrast, doesn't have the right support to the recovery programs. The hospitals are full and people are condemned to isolation. Stigma is a matter of human rights. Recovery is also a matter of human rights. And in my country, the narrative one is of discrimination, non-access to treatments, and the closed doors to the standard minimum of rights. And this is a violation of human rights. So there are very few NGOs like In Contrast in Portugal, unfortunately. But it was in Contrast that I found others walking in this path like me. I'm not alone. We are not alone. We are hope activists and tearing down the walls of shame that still insist of coming up. I'm a new leader of In Contrast. It's an honor to me, and I was very doubtful about my leadership in this NGO. But I have my profound purpose that mothers and childs, families like mine, don't have to go through what we did. But they still do. So maybe I didn't told you one thing, last thing, I promise to respect the time. But I didn't told you that my mother is an artist, a brilliant one. And I'm very proud of her. And she taught me that the aesthetics of life, that's why I always speak about beauty. The aesthetics and the ethics of care are important in mental illness. So this is our story. I don't know if it's an easy one, but I know that it's a real one, and that there are so many like ours. And above all, I believe that we can choose to live a happy story, no matter the diagnosis or difficulty, because from fear come beauty, from isolation come trust, from shame come courage, and from silence, like I did, come voices like I am now. Please you all that are listening to me here, you are in European Union advocating, you maybe know a lot of people more than I do. Please help us to make up my government in this issue. Please help us to protect of human rights in all European Union. Please help us to be just human. So thank you.
Wow, thank you very much, Joanna. And that was the reason, I guess, that we really wanted you to come here, is it's always, I think, at least for me, and maybe my colleagues are better at doing it than I am, but I think sometimes we get here in Brussels, we get quite caught up in the Brussels bubble, and we get quite caught up in the whole European side of things. And so I think we really do need testimonies and really quite beautiful stories like your own to remind us this is exactly why. And I think I speak on behalf of all of us here. This is exactly why we got into this line of work in the first place, to help people and to increase rights for people. So I think it's really, really important that stories like yours and testimonies like yours are shared as far and wide as we can. So thank you so much for your story, for your courage, and all the awesome work that you continue to do in Portugal and beyond.
Thank you so much.
Now, this opens us up to the panel discussion. We are running slightly late, but that's okay. So I guess first off, I'm going to start with quite a generic question. So for any of the panelists, just feel free to put your hand up, unmute yourself, or anything, and then I'll come to a bit more specific, some specific questions for each of you. But the first question that I kind of wanted to ask you all, or whoever wants to answer, is basically, from your perspective, what are the biggest gaps in how we currently collect, use, or understand mental health data in Europe? And the work that you've done, what do you believe are some of the biggest gaps in the way that it's either collected, if you're in the collection phase, in the way that it's either able to be used if you're in the analysis phase, and yeah, maybe also the way that it's understood if you're more in the phase of trying to look at this sort of data. So feel free to jump in if you have thoughts on this. Vladimir?
Yeah, thank you. Yeah, from my perspective, what I've seen, there are a couple of issues. So first of all, the data fragmentation. Data stored somewhere in different places, usually completely not connected to each other, in completely unstructured, not readable form. And I mean, they exist, but they cannot be used. Yeah, and that turns us to a situation that we cannot analyze it, we cannot summarize it, we don't know anything about that. So that's the, from my side, biggest challenge nowadays, how to make this data really accessible, store it in a proper way, secured way, and at the same time structure it properly, and then make it accessible for different kind of ways. Yeah.
Really, really interesting, and wholeheartedly share exactly what you've said. Honestly, it can be a total nightmare just trying to find any sort of European level data, particularly for some reason when it comes to mental health. Did anyone else have any particular comments on their troubles or their kind of ways when they're looking for data or looking at data? Otherwise, we can move on to another question. Okay. Right.
Karl, you're muted.
I've muted myself to speak. Well done, Karl. Okay, so the next question that I'm going to be asking, as it came up in I think it was really interesting in a couple of people's presentations, and we were talking about the sort of disparate strands of everyone working on their own little mental health. And I guess it's mostly directed to, or will mostly be directed to Camille, but for anyone else, feel free to jump in. Camille, I know you at Mental Health Europe and us here at GAMIAN-Europe and probably in many other organizations have been long advocating for an EU mental health strategy. Why do you feel that a coordinated approach at this EU level, especially when it comes to addressing sort of data or gaps in evidence-built policies, why do you think it's so important?
Thanks for the question. I just had also an idea about the question before, but I couldn't mute somehow. So it's just like, I want to come back to what Peter said in the introduction about the fact of not having data leading to invisibilization. And to complement a bit of that, sometimes like having data, if they're not disaggregated, also lead to invisibilization, because that's not, we just don't need data for the general population because the needs are different to any group. So I just want to bring that kind of pitfall here. We are asking for data, but we are not just asking for any kind of data. We need data that we can actually use and not use to put in place policy that won't be informed and that won't be targeted to the need of the population, because group in vulnerable situation, they cannot access. I think it was very clear in your presentation, Ahmed. Sometimes they just like, they don't face the same kind of barrier to access mental health service. And if we give like a kind of common answer to those different problems, we will not improve. And that leads me to your question about the need for a European strategy. And I think it's very, very clear from also Joanna's presentation. And that's what I said, every country are kind of facing the same problem, but they're facing it in isolation. And not one country has shown so far the ability to be able to respond to this need. So the European Union, that's the role of the European Union, to make sure that all the countries have different, have this kind of common direction. So of course the EU cannot go and fix the problem in every country, but they can give this common direction. They can give monitoring. They can give the space for peer learning. They can give the space for a person with a lived experience like Joanna to be able to speak to the member state representative, to be able to bring their testimony and to be able to inform the policy like this. So we do need this strategy and we do need this leadership, because I think what we hear from countries is that they really want to work on mental health. I mean, in France, this year is the year of mental health, or last year was the year of mental health. But what change did you bring on the ground for the French population? We don't really know. So there is this willingness to act from every country, I think, but there's just this kind of, it's overwhelming, like what we're going to do when we look at the scope of the problem. So the EU is really there to give the direction, to give some guidelines, to try to explain like how this action could look like, a trial and error, to put in place peer learning, to put in place technical support for the member state. And when it comes to data, we need to be able to compare, and no one country can do it alone. We know that every country has different data collection mechanism, but now with Eurofound, they have launched now every year they do this online survey on the quality of life of European, and the data that we get from there is really, really great. So we need the EU to also give us the tool and to enable every country to bring this data up. So voilà.
No, excellent, and wholeheartedly agree, Camille. I think particularly, as I mentioned a bit later, just when we were trying to even do the research for some of these dashboards, it was so poorly disaggregated. It was so all over the place, which kind of touches on what Vladimir said. It really is a mess. It really is a mess. And as we kind of know, anyone knows, if you're trying to truly understand an issue or a problem systemically with that sort of data, it's impossible. Now, speaking of data, I wanted to go back to, and this is probably more for Vladimir, unless anyone else had anything to say on the strategy. Sorry, I felt like maybe, no? We're okay, move forward? Okay, so yeah, Vladimir, when it comes to data sharing, in a time, particularly at the moment where we see that trust in political institutions and trust in general is pretty much in the toilet, it's pretty much at an all-time low. How do you think that you can convince people that sharing their data helps secure their rights rather than putting them at risk?
That's a good question. I believe, it should be a work from different angles. Yeah, from one side, what is already European Union is doing is, of course, to set up the proper regulation and to ensure that each and every country implementing this data sharing space, following this regulation, and there is a control on top of that. But it won't push people to share data. Yeah, from other side, I believe that if you're talking about how to convince people to share data, make them feel that it's secure, is to really to show, first of all, the value of this data. I just don't want to share my data just for purpose, just because somebody wants it. Yeah, why? It's my sensitive data. So if I understand that really my data, first of all, treated carefully, and I can control it by myself, there is a tools which I can use to understand who, where, and how is using my data. Yeah, the second part. And the second part probably is to really make people and show to the people, okay, you share this data, this how it impacts on the quality of life of people. This how we used it, and this which results we've got. Because in that case, I would be happy to share my data if I really understand that they're not just used for some commercial needs of, I don't know, research or pharmaceutical organization, but they're used to improve the quality of life of myself and people around me. Yeah. So I believe this is something it should be, and something probably is now missed a lot in all these programs is that, I mean, patients and this patient organization should be more and more involved as a partners, as a real contributors and the real partners in that case. Yeah, my vision.
Yeah, thank you very much. And it's definitely a tough one, I think, particularly whenever it comes up, the question of trust. It's always a really, really difficult one. So I think I want to go to the next question to Ahmed. Talking about, you briefly sort of mentioned the role that schools should play, and I guess particularly obviously from the LGBTQIA plus community's point of view, what roles do you think that schools and education systems can play when it comes to collecting data to deliver inclusive mental health services? And how do you think we can try and protect their rights and privacy in the process? I guess it's a bit of a tough one again, but it's sort of course, when you think of younger people, there's this whole extra element, I guess. Yeah, what sort of role do you think the school could have there?
Yeah, I think like building on Vladimir's also that I think when you have like trust in the system, when you have a trust in the schools, when you have trust in your teachers that they are with you, not against you, then it makes it easier for young people to go and report and speak about their feelings and and they try to seek help. But when they feel, for example, that they are in spaces that is very hostile to them, that see them invisible, that they won't do anything when they report like bullying or having threats, whether online or offline, then there's a very hard chance for them to come and seek support and help. And that's what puts, like, of course, like that puts the responsibility on the school system, right? So they're the one who need to take initiative on building systems that will make LGBT youth be able to feel seen. For example, like having promotional materials in schools that is LGBT friendly, you know, having like systems as counselors or psychologists at the school premises that would help them to come out and speak with them. And I think also maybe an element that would help them to I don't know, to collect the data and have people to come and seek support is making sure it's maybe anonymized, maybe offer online platforms where it can be anonymous. When it's private, I don't know, like find ways to have like maybe private rooms, private like tools for them to come and use such areas, and also having like informed consent, I would say, to just make sure that the LGBT youth are the ones centered. They're the one who choose when to talk and how to talk, and it's not forced on them. And it's their choice to come and speak and seek that help. So I think this is like all the three elements that's important for a school system to have. But,
yeah, excellent. I guess that question of trust just comes in. It becomes a bit of a vicious circle, right? Because if you don't have the trust, you can't have these sorts of things. No one's going to come on board. So it really is, I think, I'm a fundamental believer in trust, and the institutions really need to win back citizens' trust in general, and particularly those from vulnerable communities. Joanna, in your work that you do supporting individuals with severe mental health conditions and mental health conditions in the community, how has stigma affected both recovery and visibility? And from your point of view, being on the ground, what sort of data do you think would help to decision makers to make the problems more visible?
So, well, stigma is one of the side effects of the mental illness that makes profound mental illness and isolation. So, stigma is it's very dangerous to prevent mental health and to the recovery of mental health issues. And we have stigma for about millions of years. So it's not it's not so quickly to change the mindset of our stigma, but because we all have stigma, and we have to realize that we all have afraid of what we don't know. But especially in Portugal, what happens, and I think this demonstrates what I think it's ridiculous and it's a way of stigma a lot. It's like if you have a diagnosis of something physical, some physical disease, well, you have a program to your rehabilitation and to have specialists that are going to see you. And if you need to do recovery programs, you go in Portugal, you have access to great recovery programs in physical issues. But if you have a mental illness, and if you are diagnosed with, like, for example, schizophrenia, in that moment, you go to the social security programs. So why? Why? This is the mindset, you know? So in that moment, that second that a person is diagnosed with a issue, immediately the stigma button is on. And you don't ask the person if she needs something. You assume that in that moment, she is a social problem. And that's not truth. And that's what it's an obstacle that people have then the right to the access to the good treatment and to the recovery programs that are completely proved scientific ways that are essential. After that, if you say to your friends and to your community that you have a problem of mental health, well, and we have this sentence here every day, if I am looking for a job, I don't want that anybody knows about my struggle with some issue of health, and should be opposite, because the companies should realize if they have the jobs flexible and to the profile of the person, they will have more productivity. So we are not thinking well about this, and the stigma is everywhere, and it is in our friends community. So this is what I face every day. This is what we tried is to normalize and to say, no, this is not the end of the world. It's just the beginning of a new and wonderful one that like every life, in every issues. And the second question was?
Oh, no, it was saying maybe given that this is the case for you, is there any particular, from a data perspective, is there any data that you would like to see that you feel could help your battle or to help you advocate with policymakers within Portugal or at the national?
Well, I don't know if it's possible to do this, but I think it would be very important to us to have these two information. What is the costs? Because governments are always thinking about the costs of everything, and we understand that, of course. So what is the costs of the programs? For example, a program of rehabilitation, psycho rehabilitation for a person, and what is the cost of don't do this? Okay, so for example, it's easy to know how it costs a rehabilitation program. It's more difficult to understand what costs not to do that, but it's possible. We have studies in that way. So it could be just to understand how to do this, but because this would be a great argument to say if the state, the governments don't support these kind of programs, the costs of don't support this would be stronger, because people are going to be more isolated. They are not going to find a job. Perhaps they go to the streets. You know that it's the end of the line is like that. So we have to be very clear what happens if we don't support these kind of programs.
Yeah, that's a really good point. And to maybe people in the chat or people who aren't aware, going back to your point on stigma, there was a paper released, I think it was in 2022 by the Lancet, talking about how in many cases, when it comes to stigma around mental health, many people, and this will probably be no surprise to you, Joanna, many people find that stigma in many cases is actually worse than the condition itself. And so there is, yeah, and so there is some data out there, and I guess it's hopeful that, I don't know, the policymakers are listening and they understand that truly how detrimental this data can be. Now, I'm keenly aware that we are running very, very short on time / we are over time. But I would just like from the panel speakers at least, before we move on to the small presentation that we have, I'm a big fan of ending things on a positive note where we can. So I guess from all of you, from whoever wants to respond, what gives you hope right now in the push for a more equitable, evidence-informed mental health policy across Europe? Tell me one thing, if you can, that gives you hope about the direction maybe that Europe's going in terms of mental health policy, if it's possible.
I think for me, I would say it's just having all of you here and seeing you as defenders and knowing that you would be allies. And when it comes to it, within all those attacks and angry mobs, I would say like when we have like people who can defend each other and we all know that we're all on the same boat, I think this gives me hope. And I know that we're not alone. And it just like, yeah, makes me feel like, yeah, it's the future might not be as gloomy as we might think it is, because we can always like fight back. So that's what gives me hope, I would say.
Excellent.
Yeah, I think on my side, I can echo that, like working in Mental Health Europe, we see all the support around the European Mental Health Week. And what is very important, and I want to piggyback on what Ahmed said, is I feel like now there is an understanding that when we are working on mental health for specific group, for specific of people, we are not just doing it for the well-being of the person that are identifying themselves for that group, that it actually creates a better society for everyone. Like inclusion is not just for the benefit of the people that were excluded by our system and by our society, is for everyone. We are all winning. Our mental health is improving when we are living in a diverse, in an open and truly inclusive, fair and equal society. So I think that's something that gives me hope, is to feel this discourse also being strong and being able to fight back what we are seeing in terms of backlash on the right of different people all across Europe and the world, unfortunately.
Thanks, Camille. Joanna or Vladimir, do you have any final comments you want to put in?
Yeah, from my side, I'm just echoing what colleague said. The most important is that we all are here from different areas, focusing on this topic. And I can see that there are a lot of such activities, and people are really not just thinking and talking, but they're implementing step by step different things, regulations, solutions, and so on and so forth. And that brings me hope. And we will see how it will move forward. I hope it will not stuck only on let's say talks, discussions, and sharing the problems, but it will start moving to really solving the problem step by step and showing how it what is the result and how it impacts on the quality of life.
Thank you very much. Joanna?
Yes, so hope it's one of my favorite words in the world. So yeah, we always have that. Must always have that. I'm not very positive with the future of politicians, and but that doesn't eliminate the hope way. I think the hope is our people. We have to be more close to people. We need to give more voices to people, to stories, because in the end of the day, you can have great data, and it's very important to have great data because it's at the arguments that we need, and we need that so strongly. But at the end of the day, it's the names that matter. It's the Karl, Camille, Vladimir, Ahmed, Elise. It's the names that matter. So we need to do these two things: to advocate, but also to give voices and to hope that the voices go to the heart of the people, and to understand what Camille and Ahmed said, and Vladimir, that the importance of inclusion, inclusive society, intercultural society, and in human rights society protected.
Very well said, and thank you, everyone. Now, we are going to very quickly get to the exciting point of the event, which is to actually launching of the dashboard. It will be slightly anticlimactic. It will actually be released towards the end of the week because of development things and all sorts of things about computers that I don't try and understand. But in the meantime, the data that we have compiled here, my colleague will give you some brief insights into it. And just as a sort of a teaser, The dashboards themselves that will be released, there is one that will be looking at the prevalence with the latest EU-wide data that we could find. There was one that will be kind of looking at the policy sphere, again, with the latest EU data that we could find. And surprise, surprise, in some cases, it's not particularly recent or there's a lot missing. And then finally, we have a dashboard specifically because it's come up so much, and particularly from our members, looking at stigma and looking at the stigma data that we could find, which is from an EU barometer, which came out a couple of years ago, which again, when it goes to the level of communication, there is actually some quite good data in there, but for whatever reason, I don't think from their side, they did a particularly good job of communicating actually quite good data that they'd put across, which actually in the chat, a few people were talking about the communication and the accessibility from the EU point of view, and I think this really mirrors it. So without further ado, I would love to introduce you to my colleague, Elise, who's going to walk you through.
Hi, everybody. Hello, everybody. Thank you for the panelists also for the discussion, and thank you for everybody for joining today. And again, I just want to briefly introduce you to our dashboard so that you can again go to our website and navigate and discover it yourself. So basically, we have three dashboards, as Karl mentioned, and the first one I would like to show you is the policy dashboard, which has a lot of elements, including this one, which is the mental health budget for each European countries. So what we found is that out of 27 countries, only 12 countries there are 12 countries with no or specific data, and only 7 countries report spending under 5%. And the rest, which is 8 countries, provide figures. However, this data was very outdated, for example, 2013, which really shows there's a lack of transparency in data and really reflect how mental health is not financially prioritized. And without this budget transparency, of course, we cannot demand for better service, better investments in mental health, and of course, which means that the rights of people remains out of reach. And next is the stigma dashboard, which is a topic that has gained a lot of attention since last year. As you know, last year, World Mental Health Day, we specifically focused on stigma. And through this stigma score, you can see that the EU average is pretty high already, 59.5%. And for countries, for example, Bulgaria, Croatia, Romania, these countries are above EU average. And the highest is Slovakia with 70%. And surprisingly, Finland is almost 70%. In total, more than half of the EU countries are above EU average for stigma. And this is really not just a perception problem. It is a rights violation because it limits people to access to care, employment, and their dignity. And again, I want to show you how these data are quite useful, because next we have another data, which is the prevalence of mental health condition by country. And with the prevalence, we can also understand how each country responds, have policy to respond to tackle this issue. So we are just picking these 4 conditions. However, on our dashboard, there are more conditions for you to explore. For example, depression, with the highest being Greece of 8%, Poland 3.5%, which is the lowest. Bipolar in Austria, it's 1%, and Bulgaria with the lowest of 0.5%. And for anxiety, Portugal has the highest percentage of 10.3%, and Czech Republic has the least 4.6%. And lastly, schizophrenia, the Netherlands has the highest, which is 0.5%, and Austria with 0.3%. And with this dashboard, We can also compare between them as well. For example, we can see that Cyprus report to have one of the highest anxiety rates, but less than one of its budget is spent on mental health. And as Joanna has mentioned earlier, Portugal has a consistently high prevalence of mental health, high prevalence across all mental health conditions, but still it struggles with a lot of stigma and low investment in mental health. So these data really show a policy gap, which really reflects that the needs of the people are clear, but the response are not met. So I just want to sum it up. So as you see that many EU data are missing or inconsistently reported in the data set. And also, as Camille mentioned earlier, this makes regional comparison challenging, which leads to poor visibility in policy making or for countries to learn from each other and implement best practice. So we at GAMIAN-Europe, we really believe that without regular, standardized transparency reporting, mental health will remain structurally invisible. And these data are not just number, they are a way to empower people. And with open data, people as the citizens, advocates, and policymakers can be informed. And also it's a call to change. And if we don't measure it, we cannot fix it. And again, to emphasize, if we do have robust harmonized EU level data, we can make the invisible visible and the ignored accountable. So I hope you stay tuned for the launch of our dashboard, which is coming in the next days. And I will pass on to Karl for his last words. Thank you.
Oh, we've got some echo problems. So here I am with a big echo. So just the big caveats on this data is it sort of came out, and there's probably a few of you saying it's the latest, particularly when it comes to the prevalence data. The way that we sourced it was from the global disease burden, and it was actually the only EU level, the latest EU level data that we could find was from 2021-22. So at least it was post-COVID, but still it really goes to show, and the irony, or I don't know if it's irony, but the interesting fact that we had to find EU level data from a non-EU organization really points a finger at maybe the level of investment there. So just to, kind of have, as a final call to action, we're going to be launching these dashboards within the next 2 days, and they're powerful tools. They show us basically how much is missing and how much is out of date. And even when this data exists, and this really comes back to what a lot of speakers have said, it is not broken down by age, gender, or marginalized groups like LGBTQIA+ and youth. So we urgently need more, and we need more current data. And without it there, there's no real way that we can have any sort of accountability, no targeted investment, and no way to actually ensure that mental health is truly recognized as a social right. So let's be clear. Good mental health is not a luxury. It's a foundation for education, employment, dignity, and inclusion. And data, at least to us, is how we make that visible. So to the final call for action, to the EU institutions and national governments, invest in robust, disaggregated, and regular mental health data collection and make it public. To our dear colleagues and friends in civil society here, use the data that's available, as I know a lot of you are, to push for change and challenge the gaps that remain. And I'd really like to emphasize that second thing, to really, where we can, challenge those gaps. To researchers and innovators, ensure that data serves people not just as systems and protects the rights of those whose information you use. And to everyone else, remember that data is not just about statistics, but it's a pathway to recognition, dignity, and action. So let's not just use data to describe a problem, but to demand change. And to repeat, as my colleague said, let's make sure that we make mental health visible, and let's make it a right for all. So we would like to conclude the webinar with a very small 1-minute video from another one of the fantastic co-chairs of the Intergroup for Mental Health, El-Salawy, an MEP from the S&D Party from Malta. So we'll load that up, and then you're free to go and have lunch. So. Can we hear it? Can you hear it? No. Let's see. If not, we can go to lunch early and people can look at Alex later. We'll try one last time, and otherwise we'll encourage you. We'll send it, or we'll in some way get it to you. Let's have a look. Do you want to try one more time? Nope, not working. Okay, I guess it's just one of those days. Rather than make you watch just the videos with the subtitles, what I will do, and in any case to all the people who attended and all the people registered, as soon as the dashboards are ready, which as Elise said, it should be a couple of days, I'll send you links to where you can find it. What I would really, really emphasize as well, if you see errors, if you see things that you don't think are quite right, feel free to challenge it. Feel free to let us know. As we're saying, it's far from a perfect picture of Europe, but we did the best with what we've got. So yeah, what I will also do is I'll put the links to both Maria's message and to Alex's message. And just, yeah, from the bottom of our hearts here at GAMIAN-Europe, thank you to all the wonderful speakers. I think it's really awesome, and it's been reiterated time and time again how great it is to get so many different segments of society together and really making sure that we can work for, to quote Mental Health Europe and all mental health in all policies. And so to everyone else, I'd really encourage you to look out for the rest of the activities for the European Week for Mental Health. There's some really cool stuff out there. And from our end at GAMIAN-Europe, of course, obviously, if you're interested in any of our work, if you're interested in any of the projects or just want to get in touch to talk about anything at all, feel free to reach out. We will reach out to you with contact details. Thank you all. Have a lovely rest of the day, a lovely rest of the week, and I hope to talk to you all soon. Take care.
Thank you for hosting.
Thank you.
Thank
Ciao,
you,
ciao.
everyone.
Thank you.
Bye.
Bye-bye.